Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back. And as we said earlier, today is the official one-year anniversary since Belize reported its first case of COVID-19. And to take a look back as to how far we've come, we decided to hear from COVID-19 survivors themselves. So we have 4 guests with us. We have Rolando Montero, we have Wilema Alamilla Gonzalez, we have Honorable Jorge Espat, and we have Ingrid Vega. Good morning.
Good morning. Good morning.
Well, thank you so much for joining us this morning, and we appreciate you being willing to share your story with us. Just let's start off with your reflection, looking at what it feels like to be 1 year after we first started to battle this pandemic. What comes to mind for you?
Well, I can start. What comes to mind is being thankful. Being thankful, I celebrate today not the pandemic, but I celebrate life. You know, and I celebrate that our numbers are less. I celebrate that Belize now is in the session of the vaccination. So I celebrate that we are more likely to be in a so-called, we're going to soon be, and hopefully soon be, in a normal state as what we used to call it. So that's what I want to say a whole year later after this pandemic, because I really don't want to celebrate the pandemic, but celebrate life, because we're here. And thankfully, we're here to talk to you about it.
And go ahead.
The same for me. I am very, very grateful that I'm alive. And for me, it's more like an appreciation of life and an appreciation of everything. This pandemic and the illness, COVID-19, taught me to not take for granted a lot of things. Not take for granted even being able to just be able to breathe, it was an experience where you were aware of every little thing that every day you do, and how challenging it was to live a normal life with the virus. Like it was, at some points, it was difficult to walk, to sleep. So I have a great appreciation of everything in my life. This is like a second opportunity for me, and I'm grateful for that.
Yeah.
This year has been a very challenging year for Belize, for many families who have lost their loved ones in the world. It's been very challenging too. At the beginning, we didn't know what the COVID-19 was, but a lot of people, a lot of researchers, a lot of doctors have put a lot of effort in trying to combat this disease. And we need to thank all the health workers, all the frontline people that have gone out of their way, have sacrificed their lives, their families, to see how best they could challenge this disease. So it is a reflection of what has been going on. You hear in the Bible about diseases, but we never take these things seriously, until it happens to you.
Yeah.
So I am very grateful too to be here and talk about my experience.
Yeah.
You never think that this could happen to you. You always think positive. Oh no, this will never happen to you. I used to tell my friends, wear no mask, social distance, wash your hands. But I believed that it could happen to me. And on the 11th of December, my brother-in-law called me and told me, you know what, Rolly, I just tested positive for COVID, and you were with me over the weekend. I would recommend for you to go and do your test. Um, I stayed quiet for a little while. Then I told him, okay, I'm heading to Bangapan to do my rapid test.
Yeah.
And I went to Bangapan and it came back positive, no?
Yeah.
So I immediately called my family and informed them. Traveled back to San Ignacio and did my stayed at home, no, for a couple days.
Yeah.
And from there, things started deteriorate. No, I started with a.
Your family your family tested positive as well? Your immediate family, the wife, the kids?
Yes, my wife and kids went to do their test the following day, no, because it was a late afternoon, no.
Yeah. Rolando, you have a really interesting story, and I want to get back to it in just a few. But let me just get Honorable Espat's reaction to the 1 year anniversary.
Good morning, Marlene. Good morning, Gavin. Good morning, Belize. For me, I wouldn't really like to state celebration of COVID-19 for the first year. It's a sad story for many of us. We have had family members, we have had friends, fellow Belizeans. Also, we had lost one of our colleagues in our political career. It's very hard to say. I would rather like to say that I would rather like to say that I am thankful for all of us that God have given us a second opportunity to be present here today to continue our day-to-day life. Thank to all the efforts of the medical workers, to all those that created the medicines for the cure or to try to stabilize our health back to normal. It's a sad case. I've been through it, and I wouldn't wish that upon no one, especially the expenses, putting the burden on the families and the risk as well. So I would like to rather state I would be thankful for the second opportunity that our good Lord gave us to be here present today.
Yeah. Now let's talk about your COVID story. And Rolando, we can go back to you so you can tell us a bit more. You tested positive in December, and so there'd been some time already. There was this huge spike in September. Tell us a bit of how worried or the fear, if you had any fears at that time.
When I tested positive, I didn't feel no fear. I said I will get over this. It will take me probably a couple of days because I had talked to some friends and they said the most it's 2 weeks. So I had a positive mind that within a couple of days I'll be back at work and I will continue to live my normal life now. Unfortunately, that was not the case. Over the weekend, I started deteriorating. No, I didn't want to, according to my wife, I didn't want to go out from the room, just lie in bed all day, don't want to do no exercise. That was over the weekend. On Wednesday, my brother again, since he had tested positive, he had to be rushed to the polyclinic now. And his oxygen level was about 87. So my sister-in-law called my wife and told her, you know what, I think you should check Ronald's oxygen level because Rick is at 87. So they tested my one and my one was at 82. So I was immediately rushed to the San Ignacio Polyclinic, no, where they administered some oxygen. And during that time, my wife started making some calls. She called my niece, who's a doctor too, no, and she told her, you know what, you need to move Rolly immediately to Belize City. Because at 87, he could only deteriorate, no? So they managed to get an ambulance and take me to Belize Medical Associates. That was on Wednesday. I didn't recall much. On my way to Belize City, all I could recall was the paramedics asked me if they could pray for me, and I told them, yes, go ahead. And from there, I don't remember much when I went into the hospital in Belize City. No. From there, my memory, I think I was deteriorating health-wise. No.
Did you feel as bad as the emergency, as how they were treating you? Did you feel?
Pardon me?
Did you feel as bad as all the emergency care that you were receiving? Because you said you only did the oxygen saturation test, and that kind of triggered all these things.
Yes. Yeah, during that time, I only had a cold and cough. I don't recall any pain in my body and no other pains. No. But I think mentally I was deteriorating, and I didn't realize it, no, because I couldn't recall several things that transpired during to the Wednesday that I got to Belize City. No. From there, I think Dr. Coyer took over, and I think by the 16th, I was health-wise, I had deteriorated that he had to intubate me. I think about midnight, from what the stories they are telling me, no. And I think I spent about 6 days in intubation, no? And I think they started bringing me back, what was the 24th of December, sometime 24th of December to the 25th in the morning, no, which was Christmas Day, no? When I got up, I was completely lost. I didn't know where I was. Wow. At one spell, I think I had hallucinations that I thought I was in a hospital in the US. No, I didn't ask because I was confused, depressed. That morning, my wife went to see me, and I think my spirits came back. No, and then she told me where I was, and had good care at Belize Medical Associates. They used to check my oxygen level, my temperature every half an hour, and it was a long process.
Wow.
I was confused, lost.
Yeah. To go from feeling perfectly fine to in a hospital and then eventually intubated.
During that time, you don't know. So till after I came back, the only thing I could remember before I was intubated was the Dr. Coyer told me that. Yes, I remember clearly. He said, "Rolly, I'm intubating you, but I promise that I will bring you alive," and that gave me hope.
Yeah.
And
that's a scary.
From there, until they wake me up sometime around the 24th at night, and then transpired over the few days. Now, then I stayed there until December the 28th. Now, when he said they did all the necessary tests, and he told me you're good to go home and rest. But during those.
Rolando, during that time, you know, when we still think about it, and I know Ingrid has a similar experience, so I'll get her to share that too. When you hear intubated in Belize, which means, you know, mechanical ventilation to help you breathe, especially at that time, it was a very concerning moment in treatment. You know, so when you're told by your doctors that this is something that has to be done, you know, what goes through your mind?
Honestly, Marlene, I don't remember.
Yeah.
If he spoke with me about intubated me, up to today, I don't. All I remember was he told me, "I will bring you alive." I
And that was your comfort.
how my wife and my kids felt when they got the call, you know, that they gonna, because at that time there was, I think, only Mrs. Vega had survived intubation, no?
Yeah.
So it was, I think, was a very scary experience for them. But honestly, Marlene, I don't remember.
Yeah.
I don't remember anything. If probably Dr. Correa had a discussion with me, but I can't, I don't have a memory of that.
And Ingrid, do you want to?
Yeah, I understand what Mr. Rolando has been saying. You tend to not remember what's happening. You're like in a state of shock, you know. And at that moment, I have just gotten the news that my husband passed away. So I was like, oh, okay, you know, like, but before that, when you're hearing people getting intubated, the first thing that comes to your mind is like, oh my gosh, that's it. You know, like you've never heard anyone getting back from this intubation. So that's the first thing you tend to think about. But at the moment when they told me that I had to be intubated, I think I was in a state of shock, I would say. I can't remember. I just kept on thinking that I need to get back to my girls. That's all I had in my mind, you know. So yeah, it can be, and then after that you don't remember what happens next.
Wow.
And at that point, how were you physically feeling, if you can remember, you know, in terms of the actual symptoms that you were experiencing?
Well, you know, like I wasn't feeling too bad. Like it just happened so quickly. And at that point, my sister would be the one telling me bits and pieces. And she told me that when they called her, I had the opportunity to talk to her.
Wow.
And she said, yes, I was having a hard time breathing. You know, it was difficult for me to breathe. I was like, you know, and but I didn't feel any pain or anything. I can just remember they telling me I need to be intubated and that my saturation was not good at all. So they really didn't give me figures. I can't tell you where my saturation was because I think they didn't even want to tell me how my saturation was at that time. So they told me that it was not, I needed to be intubated.
Yeah.
You know, but I didn't feel any pain or anything. It was just a difficult breathing.
Yeah. And Jorge, you also had to be hospitalized for a period of time, right?
That's right. I was in for 6 days.
Yeah.
Actually, it was a very bad feeling, being alone in a room, monitored by a camera, and we had the nurses from time to time in their suits just come in to administer the medication and write out again. I was admitted on Sunday evening, actually, and I was released on Saturday evening. For those 6 days, I was in bed, face down. A very, very bad experience. All the lines, oxygen, drips, the oxygen control level sensor everything was placed on me. Actually, the monitoring of the blood pressure as well. So imagine being hooked on to all of those lines, lying face down, nowhere to go for 6 days.
Yeah.
And I got concerned, I believe it was on Wednesday, when they changed the oxygen system on me. and the response was that the system was changed so that oxygen can reach to my lungs. And that's where I started to get a bit concerned. Knowing that if that didn't work, that it meant intubation for me.
Wow.
Thankfully, I believe I was the first one being administered the remdesivir. It was in the country. I do not know for what reason it was not accepted by the previous administration. I made sure it got out, and I was the first one that started to, the first candidate for it to be administered on. So I got in on Sunday, and by Saturday I was out. Those were 5 doses administered. As I mentioned, it was a very sad feeling, not having your family around, not knowing from the outer world. I mean, you being locked on that 4 walls there, all alone.
Did that also make you nervous in terms of being one of the first to receive that course of treatment?
Yes and no, because at that time you want something to make sure that you get out of the loop of the risk involved, knowing that there had been a lot of people at the time that had been in the criteria that passed away. For certain and for sure, I didn't want to be on that list. So at any cost, I was looking for a better treatment. I was in healthcare partners. My son got diagnosed on Saturday. I recall I was in Color Creek looking at the flood victims at that day, and by Sunday morning, I started with a high fever. That's when I went along with my other son to get tested, and we both came back positive. And by Sunday evening, I was admitted at the hospital right away. My oxygen levels were at 87, I believe. And from there, it started deteriorating, 82, 84. So I was concerned.
Of course, yeah. Wilema, let's hear your experience too. You had the added concern of having family members who were high risk being positive at the same time as you. Tell us your COVID story.
Yes, Marlene, my story is a little different than the rest of the panelists. I didn't go to the hospital, so I was blessed. I didn't get to go to the hospital and I wasn't hospitalized, and I was very lucky. My story is a little different in that when we found out that we had that we were infected, it was a family that was infected. We were all feeling well. My dad kept complaining about an allergy, but he kept working. He is a fisherman, and he was out fishing every day, and he did complain about that he was tired and he had a little cough, and he kept saying that it's just an allergy, that every year, and rightfully so, every year around that time he comes down with allergies. And excuse me, let me just get this.
Yeah. Somebody else is trying to talk to you at the same time.
It was the radio in my office. I apologize. So anyway, he kept getting worse, and we are in San Pedro, so we went to BMA at Grand Caribe, and they did the rapid test. Because we were all there. Well, not all, but like it was my mother, my father, my son, and then myself. Now, my father is 76, my mom is 70. My son has chronic ulcerative colitis, which it's an immunodisease, and his immune system was compromised. He was taking immunosuppressants. He's under a medication called Humira too, and everyone at home was being super cautious because we didn't know if that my son would survive it if he got it, and that was our biggest concern. So really none of us went out, just my dad. He was the one in charge of grocery shopping, of getting all the essentials, and so, and my dad was extra careful. Like we had, like everything at home was regimented. Like we would go, my dad would be the one to go shopping. He would, when he come home, he would change, he would shower, like everything would go like at a place where it would be disinfected, like all the groceries and everything. We took extreme care. So when I kept telling my dad to go get tested, but he could not, I think that he couldn't accept that there was a possibility that he get it because he was extra cautious. When we did go to get tested, four of us, my daughter also lives with me, and somehow she did not get it.
Wow.
Go ahead.
I was going to say just, so when you finally get the positive results and your son is high risk, your dad is high risk, what's it like? Because you still have to ensure that you're taking care of yourself, but, there's just this predominant fear.
Well, I honestly, like the best way I can describe it is I found out when I read the results and I saw that my son Rudy was positive, I honestly felt that my heart stopped because all this time, like everyone is telling me, take care of Rudy because if he gets it, he might not make it. But it turned out that because of the medications he was taking, later on we learned that Humira, which is a medication that he takes for the disease, that is an anti-inflammatory biological agent, and so that helped him. Afterwards, I heard that they were using that type of medication to help COVID patients because it brought down the inflammation. So my son, like he did struggle, but he was the one that had it, he was the one that got it mild. My dad, on the other hand, he started getting worse. He started getting worse and he was hospitalized for 12 days at Belize Health Partners, and I'm very grateful because he said up to today he keeps saying like I'm alive because the doctors there fought for me. I remember Christmas Day, and it was the most depressing day in my life because first of all you're dealing with your symptoms because I did have I did not get a fever, but I had horrible headaches. My eyes hurt. I had pain in my joints and fatigue. Like I had extreme exhaustion. Like I just felt like I could just sleep and sleep for days. I had chills, cold sweats. One of the things that I don't think we will forget or we don't talk about is the mental distress that comes with all of it too, because like I remember somehow someone telling me, just remember that the 8 and to the 14 days are the worst days. So I remember waking up every day and I'm like, I would breathe and I'm like, okay, I'm not dreaming, I'm alive. Like, it was so scary, like just the uncertainty of.
And how do you factor in that fear that you have for your own self, but then your dad's in the hospital, and that's part of the perspective that Rolando, Ingrid, and Jorge, they don't know because they were hospitalized. But what was it like to be the family member on the outside, knowing your loved one is getting treated?
it was, like I said, one of the most horrible experiences that I've had. Exactly because of that. Like, it was terrible that we knew that dad had to go and none of us were allowed to go. We were still infected with COVID, and even after we were negative, we still weren't allowed to be with my dad. And just like they were mentioning, that we knew that my dad was alone, that and it all happened around Christmas time. When we got to video chat with him, you could see like how deteriorated he was. And for Christmas Day, Marlene, we got a call from Dr. Hidalgo, who said that they have my dad in observation, and if by 6 o'clock, and if by 6 o'clock he does not respond to the treatment, they would have to induce coma. And it was just devastating. It was devastating. I saw my mom crying. My children are like very nervous. My father is the patriarch of our family. He's the one that's always held us strong. He's the one that's always like, and when he tells you his story, he was in the hospital worried about his family. Like
yeah, natural. It's naturally what you do. And I think, Ingrid, you mentioned that before, that your survival, and I always remember your story, it was all about being able to go home to your girls. You knew that you had lost your husband, you were battling the disease, it was getting serious, you had to be intubated, and the one thing that kept you going was knowing that you had to go home to your girls.
Yeah, and I think it was a sort of motivation to keep on fighting, because I always tell myself that if I'm here and God gave me an opportunity for a new life, then I can't give up. We need to keep on fighting, and I'm sure that what Wilema is saying about her family being outside and her dad being in a hospital, not knowing what will happen, I'm sure that's what my family went through with me. So and yes, I have to agree with Wilema. It's a mental thing. You gotta be strong, and you gotta put yourself in your mind, because I just told my family just the other day that it is a mental thing. Because when I was in the hospital, I set my mind that I can't grieve my husband. And I didn't, because I had to fight. I had to be better. I had to get better. And I told myself I'm going to grieve him when I get better. And now that I'm no oxygen, I am back at work 2 weeks now. I am getting better. Now the grieving started. So it's a mental thing, like your mind controls you. So yeah, it does affect you. You gotta be strong and you gotta keep on fighting.
Ingrid, every time you say that statement, it gives me chills. When you say that you delay the grief until you know you can handle it, or because you knew survival was most important. And I know that this is still something that is very raw for you, but we lost 316 people in this pandemic. We can't forget that. As much as we talk about vaccines and recoveries and curfews, people lost loved ones. Just in being able to pick up the pieces, the rapid deterioration that took place, the fact that you were handling your own illness. How are you doing with that today?
Like I said, Marlene, I am grieving now. It's hard, but I keep on praying every day for strength, and my girls are something that I go and look forward every morning and every night after work, every evening after work. That's something I look forward every day, to see them at home. So I keep on fighting every day. It's not easy. And, we gotta keep on telling ourselves that the virus is still out there,
Yeah.
and we gotta keep on being careful, because I won't wish this for anyone.
Yeah.
And like you said, we lost 316 people. And it's sad. Now that I went through it, then I think about those other 300 people and their families, because it's not only me, and I'm sure that all these other families are having a hard time, because they all had wives, they all had moms and dads and kids.
Yeah.
So they're all going through the same thing that I am going through. So it's not easy. It's not easy, but God gives me strength every day.
Yeah. And going from and we can get the rest to comment on this. Going from the fears, I know, Jorge, you spoke of it, the fear that you have while you're in the hospital. You know how serious the illness is. You know there's the potential risk for death. You know that you hear the stories of just this rapid deterioration that may take place. What was your tactic, Jorge? Let's get you, and then Rolando, to talk about how mentally you got yourself through this time. Isolation, concerns that you're ill, how bad it could get.
Arlene, on my case, being the head of the family, and my wife as well, I was very, very, very concerned, because she was admitted actually in Friday as well. And then that put us both in the hospital, leaving our family out, our business. So we left the business in the care of our boys. They were running the business actually, and we were actually hospitalized and very concerned in the case of my wife, because she's a diabetic as well. And then luckily I was I got out Saturday. She was admitted Friday. So I was out of the hospital, and at least I came back home, still under quarantine, but still yet concerned about the well-being of my wife being at the hospital. So it's a very sad situation, very concerned.
He's freezing up there, Rolando. Let's hear your point of view. How you were able to kind of.
As your being, you want the best to happen at the end of the day.
Yeah. Rolando.
Yes, I agree with Mrs. Vega and Gustavo. Mentally, it takes a drain on you, you have to think positive, because all kind of things go through your mind. You feel depressed, isolated, but fortunately, there comes the support of your family, your friends, and give you that positive, that you think positive, and all the power of prayer. Every day, my family, friends used to pray for me. I didn't believe in prayers, but after what the doctor told me, you know what, Rolly, I give you up now. And miraculously, you are here. You have to thank God. You have to thank all those people that prayed for you. Because when I had called your wife, I told her that I can't do anything else for you. And over the period of that day, said, my wife called the family and gave them the bad news. They started praying, they called friends, and they prayed all day. And miraculously, the doctor said in the afternoon, I started responding now. So I believe that God has a purpose for all of us now. And for those non-believers, the power of prayer and the power of having family support, friends that will encourage you to get over that depression that you go through. It is difficult to explain it, Marlene, if if you don't
Experience.
if you don't go through this sickness, I know Mrs. Vega could attest to what I'm saying, no. But being alone in a room, not knowing what will be the next day, and the same thing I used to do. For me, it was difficult because I couldn't sleep for nights. No, after I came out from intubation, no, it took me at least 6 weeks to get back to that rhythm. No, so for days and nights, I couldn't sleep. No, so it was very challenging for me mentally, physically. But the good part is that I had a good appetite, and that brought back my spirit because I was like a baby. I couldn't do almost anything for myself when I came back from the hospital. No? So and I'm a very active person. I go out to work every day, and being at home, not being able to do anything for myself was very challenging. But the courage of my family, my friends that used to call me and tell me, Role, you need to be strong, you need to be there for your family. And that's how I overcame it, Marlene. But if you don't go through that experience, it's difficult for people to conceptualize what you are telling them.
Yeah, you're right. I can't imagine. I can't imagine what it feels like, the isolation, the fear of getting sicker. But let's bring the conversation forward. You know, I want to hear from you what that feeling was like, all of you. Wilema, when it happened for your dad, and for you, Ingrid, for you, Jorge, and for you, Rolando. When you found out you were going home, when you knew you had beat COVID, you were one of the survivors, and not just one who survived asymptomatic, but one who survived severe illness. What was that feeling like?
Well, for me, Marlene, I was thankful, first of all, to God for the second opportunity, knowing that I was coming out of the hospital alive and not in a casket. I was thankful for the second opportunity, and to the doctors for the attention, Dr. Hidalgo, Dr. Arriaga, Dr. Potts, and the other doctors there around. It was, I was so happy to know that I was going back home in a way, but leaving my wife in the next room.
Yeah.
You know.
So that's bittersweet for you.
That's right. That's right. Yeah. But actually, that was part of it. Then knowing that
I think the video froze again. So Wilema, share your experience when you knew your dad.
Then I had insomnia. I had the cough. I had stomach problems. I had back pain. You know, and the doctor told me, you know what, it's going to take its own course. 3 to 4 months. I said, what? I cannot afford. I'm not that type of person to be staying at home. You know, I'm that active person.
Yeah. Those are the long-term effects that you said, the things you had after you came out?
Yes. I suffered. The worst thing was the insomnia. I couldn't sleep. You know, and then I had the cough. That was the second worst effect. Yeah. I had to be on the nebulizing machine. Yeah. Like if I had asthma, I started to cough like the asthma attacks, and the back pain because of the lung that was infected. You know, the stomach problem. It's like what Mr. Montero said or mentioned. We were back at like a young baby, trying to get adjusted back to our normal lives.
So let's let's go back to Wilema, and you tell us about what it felt like when you found out your dad was going to be released from the hospital.
Marlene, it was a bittersweet feeling. And the reason I said that is because we were extremely happy that he was at a point where he could stay home. But once he came to us, we saw how he was getting to San Pedro. I was scared. I was scared because I saw that my father was still very fragile. He was still on oxygen, and I was scared because I didn't know that I wasn't sure that we could take care of him the way the hospital was taking care of him, and he didn't look good. Just like Mr. Montero, Mr. Honorable Espat, and Ingrid say like it was like they were starting from zero, like it was a recovery from zero, and even today, Marlene, my dad is someone that he's up early in the morning and he never stops. Like he never stops. He's still bed bounded. He still haven't recovered completely. And his recovery is very slow. And with that, even though he knows he's home, even though he's better, even though things are every day it's a better day, I have to tell you that since our family experienced COVID, nothing has been the same for any of us. Nothing. Like I used to jog 4 miles every day. I can't even walk 4 miles now. And that depresses you and it frustrates you. And then other elements come in like depression, like stress, because you don't know, like up to now, we don't know if we're going to recover fully. Like, and some days we're doing well, other days we can't get out of bed. And it's one day it's my mom, one day it's me, one day it's that. Well, that is the one that's constant. Like the other day he tried to walk, and San Pedro's blocks are like are short blocks, like they're not it wouldn't be a long walk, but he was trying to go to the meat shop 2 blocks from my house and he couldn't do it. And I can imagine his frustration. I can imagine how he feels because he's always been the breadwinner and the support of the house, and he feels not only physically he is not doing well, he feels like a burden to our family. And I feel that that's affecting him as a human being. Wow. Like I think that he is actually in depression right now. I am not a doctor, but I can see the sadness in his face and like the frustration that not him or any of us can recover ourselves, haven't recovered ourselves to 100%. So it's still a battle. 3 months after, we're still like battling with everything.
That's the part of the story we don't get to hear very often. And I know all of you seem to share that. Ingrid, you said you just went back to work 2 weeks ago. You were released from the hospital on December 24th. It was a Christmas miracle that we were so happy to report on. Take us back to what it was like then on Christmas Eve and the emotion, but also, the road to recovery. It's a long one.
Yeah, and that's what I had all my family too with COVID, so it was a concern as well. My daughter had COVID. My 2 daughters had COVID, my mom, my dad, and that's who's going to take care of me, So my older daughter stepped up to the plate, and it's the same thing, every day I kept on, my mom and my dad didn't even know that I was intubated. They couldn't even, my sister couldn't tell them that because they were battling COVID as well. And she thought by telling them this, it would just get it worse. So when I got home, my mom's like, oh, hi, because she thought I was just going to the hospital to get better, It was just a thing because I needed to get oxygen. And she's like, oh, hi, I'm happy you're home. And like, now that she knows about it and knows that I could have not make it, then it's a different story. She doesn't even want to talk about it because it's so emotional. But we were not able to tell them because they were fighting COVID too. So, you know, but just me getting home, I wanted to be home. And I put to myself, I need to get better and I need to make that effort because it was my daughter, my 18-year-old, having to take care of me, you know. So I needed to get better earlier because now it's like Wilema said, we get up every morning and I'm, Mom, how's your pressure? Dad, are you okay? You know, kids, are you good? Are we good for today? You know, like, and then we come back at lunch and I'm like, we good? We need to take our pressure. We need to take our saturation. The oximeter is part of us now, you know.
Well,
So
I
it's
can
a
see you're
life
doing much better too, because the last time we spoke, what was it, January, February, you were still using oxygen and you would run out of breath mid-sentence. So definitely tell me, I mean, how are you feeling today?
Okay, I still have that post-COVID. No oxygen is great news. I have more energy, but I still get fatigued. I mean, I'm come to work, but I have a great staff. They take care of me. They're like, you don't eat, you need to go home and eat, you know? So when I go for lunch, then I take a breather, I relax a little and come back to work. So I am not overdoing it because I know that my body can't take it, not right now, you know? But I need to get out. I need to continue living. I need to continue doing my daily stuff that I used to do. But yes, I get backaches. I still get fatigue if I do it. I mean, my body was not doing anything for a whole 3 months. So just getting out and walking is a big thing. You do get tired. My pressure tends to go up and down every day, you know. But
let me ask a question here to all of you. You just give me a very quick response. How many of you feel that you're back to 100% of your prior self, your pre-COVID self? Anybody?
No.
No. Wow. That's very telling. We're running so quickly out of time, and there's so much more I want to hear from you. But let's close it off with one of the big moments right now. Wilema, you got your vaccination yesterday, I was told, as a teacher. Let's talk about that moment, what it feels like now to be in this phase of the pandemic as survivors. We'll start with you, Wilema, because you have your experience.
Marlene, my hopes were all came down. I got the call because Lady Bowen submitted all the names of the staff. I showed up to the clinic, and when I got there and they saw my paperwork and everything, the doctor came to me and he said, so you experienced COVID? And I said, yes. How long ago? And he said, and I told him 3 months. And he goes, sorry, I can't give it to you yet. So I was all excited. I was really excited about it, but I was asked to wait for 3 more months.
Okay.
Especially because I too, like my son, have ulcerative colitis and I'm on immunosuppressants. He prefers that, and he asked me if I feel like I've had a full recovery, I had to be honest.
So you have to wait 3 more months. But what does it feel like to see people around you getting vaccinated?
Well, I am so grateful that, for instance, all our staff at the Island Academy in San Pedro, they all are vaccinated. And it's almost, Marlene, like, you just feel safe. Like, it's just a feeling of, okay, I'm going to be working with people that are already have taken their vaccine, and so they have some immunity and they need their booster. Yes, and we're going to make sure that they get it. But it just makes the whole environment at the Island Academy. We have still not, this Friday will be the first time that we meet as a staff. And I think that we're able to do that because we're no longer scared of where have the teachers been or
All right.
Well, they be in contact with. So it just gives you like this feeling of comfort and safety.
Similar thoughts? Are there similar thoughts from the rest of the panel, just to be at the phase of vaccination when you see when you saw those vaccines arrive in country, when you see the shots going into arms? What's it like as a survivor to see this taking place?
Marlene, we need to thank the government for bringing the vaccine so quick to Belize now, because many countries around us, they're still battling to get the vaccine now.
Yeah.
I encourage every Belizean to be vaccinated, Marlene. I don't wish any person to get this disease because it's very horrible and it's mentally deteriorates you as a person. So Belizeans, don't be afraid. Take the vaccine. You will not regret it.
Yeah.
That's
Yeah.
And I also want to thank all the frontline workers, the doctors, the nurses, the people that do the lab tests. They have sacrificed so many for Belize.
Yeah.
Let's give them a thanks and let's pray for them.
Yeah. That's right. Thank you so much for that. That's a great point to close off with. Jorge and Ingrid, your feelings about being at vaccination point?
Oh, I was happy when I saw that video. I had to share it, Marlene, you know, I had to share it on my Facebook and just let it out, you know, because it was a feeling of excitement and happiness. And I am waiting as well. As soon as I will be able to get it, I'm going to be able to get it, me and my family. It is something that we should get. I mean, I think what Mr. Orlando said, let's Belizean, let's go out and get it. We need to get back to the norm, and that this is the only way, I believe, to move forward, you know. But yes, I was excited and I just had to spread it all over and share it, you know, because I was happy.
Yeah, absolutely. Jorge?
My case is that when the time comes for me, then I will be able to get it. We are not candidates as yet, but there's one thing I would like to say to all our fellow Belizeans: don't listen to rumors. There's a lot of negative sayings going out there. Take the vaccine, please. That's the only way we are going to get back on track. The vaccine is here. Don't listen to rumors. Please take the vaccine. It is free of cost. Let's get back our country and start to normalize back so that we get back to our normal lives.
All right. Well, I want to say thank you to all of you for joining us this morning. It has been incredible to hear your stories of survival. As we mentioned, you know, we know that over 300 people did not get the opportunity to complete this year due to COVID-19, but so many others have fought and survived, and we appreciate you sharing your story with us. The emotional toll, the physical toll, and we wish you the speediest recovery so you guys can get back to 100% sooner rather than later. Thank you.
Thank you
very much for having me.
Thank you.
All right. And as our panel noted, one of the key elements in being able to survive COVID, in being able to get us through this pandemic time, it's our frontline personnel. And so when we come back, we are going to be talking to 3 medical specialists about what it was like for them, being the frontline persons trying to treat people with an unknown disease in this pandemic. So that's coming up as we go to after the break. And as we go to the break, we do encourage you at home, take a moment, say a prayer, a moment of silence for those that we have lost to COVID-19.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.